Good afternoon, everyone. Welcome to our Facebook Live event. We'll be providing you with important updates today about COVID-19. I'm Dr. Leslie Phillips, the Senior Director of Research Insights and Innovations at the Benefits Group. And I'll be here to talk to you with Dr. Freddie Chen. First, I want to introduce myself. I'm an epidemiologist, and a lot of people understandably don't know what that is, and so I wanted to explain it. I get a lot of questions about skin, but that's the wrong epi. That's the epidermis. Epidemiology comes from epidemics, and epidemiologists study how disease spreads and what risk factors are for disease. Joining me today is Dr. Freddie Chen. Dr. Chen, thank you so much for coming back to speak with us again about COVID-19. Could you please reintroduce yourself?
Sure, thanks for having me. So I'm Dr. Freddie Chen. I serve as Medical Director for the Benefits Group, and I'm a family doctor. I'm Chief of Family Medicine at Harborview and Professor at the University of Washington. I also have a background in epidemiology as well.
Excellent. Thank you, Dr. Chen. And thank you, everyone, for joining us live. We'll be monitoring comments and questions and answering them at the end of the event. Please leave a comment at any time. I thought it would be helpful, since the last Facebook Live event, a lot has happened, and I wonder if you can give us a brief update on what has happened since then.
For sure. It is still a scary time. There's been a lot more attention and anxiety around coronavirus or COVID-19. Unfortunately, compared to last time we talked, there now are several more cases in King County and around Seattle. There have been several deaths as well, mostly associated with the nursing home in Kirkland. And of course, around the country, we're seeing more cases of coronavirus in various states and cities. And then we've seen countries around the world as well where the spread seems to be increasing. So we're definitely seeing more cases. Here in Seattle, we are also seeing, just over the last few days, a lot more testing for coronavirus happening in our healthcare facilities, in our hospitals. And so I'm not going to be surprised when we see more cases, because we haven't been doing a lot of testing until now. But I think we're going to see more cases for sure.
That's a really good point, that we'll see more cases because there are more cases, but they might come all of a sudden, and that maybe people shouldn't be alarmed by that, because it's not that those cases weren't there before, but finally we're on board to be able to test and identify people. Yeah,
that's right. So part of that is detection. I mean, at the same time, I think most people feel like it's likely that the virus is in the community some, and so we're seeing more cases because there are more cases, like you said.
Yeah, so that's a great point about being in the community, and I'm sure caregivers have a lot of questions about how they can protect themselves, and we'll talk specifically about caregivers as well. But I thought we'd start off more generally, because we've heard a lot of talk about social distancing and vulnerable populations. And I wonder if we could talk a little about those two things.
Yeah, I think it's really important to remember sort of who's most at risk for infection and for getting really sick from the infection. So right now we're really focused on older folks over age 60 or 65, folks with who are immune compromised. So that might be people with chronic illness like diabetes, but also people on cancer chemotherapy that might decrease their immune system, people on immune system medications, even people who are homeless or living in group homes or facilities. They're all sort of at higher risk right now.
Yeah, and so a lot of people out there might fall into this population. They might have diabetes or heart disease or any of these conditions that make them higher risk. And I think that the CDC and King County are advising that those populations try to stay home, limit their exposure to crowds and groups. And what does that mean exactly? Are we a group by being two? How many people should we be thinking about?
Yeah, that's great. So we are seeing a lot of social distancing is what they're calling. So a lot of employers are having folks work from home. We're seeing several schools start to close as well. Large gatherings of people are getting canceled because we're just trying to decrease the amount
So we were doing a hand sanitizer demonstration, and Dr. Chen was saying that really the gold standard is to use soap and water when it's available, and really do that 20 seconds of hand washing. We'll be posting some resources on our website we can link to, and we can give you some good resources for hand washing. If you don't have soap and water available, hand sanitizer is great. You put it in your hand feels really wet as you rub it around. And what you want to do is really rub that hand sanitizer in all over your hands, all parts of your hands, until that wet feeling goes away and it's dry. And talking about dry, I think many of us have dry hands lately from doing this so much. And so using moisturizer will really help, and will help us continue to focus on good hand hygiene. Dr. Chen, I think that a lot of our caregivers are really, specifically concerned about what they should do if they themselves get sick, and if somebody they're caring for gets sick.
Yeah, that's really important points for caregivers, other healthcare workers as well. So I think the most important thing is that if you get sick, if you have a cough or fever, trouble breathing, even sneezing, that kind of thing, don't go to work. Right, that's actually a really important piece, is to try to keep ourselves safe. But if you have symptoms, don't go to work. That helps prevent spread to other people, and so that's a really key piece. I think the other question that has come up a lot is what do you do if your client is sick, right? And we some clients might be exposed to COVID. Or has significant symptoms, and I think then it becomes really important, the hand washing stuff that we just talked about. Sort of how do you protect your own health in that, and try to avoid getting sick yourself. So hand washing is super important. If your client has symptoms, is coughing, you might think about putting a mask on the client. And then that might be an opportunity for you to think about wearing a mask as well.
Those are great suggestions. I know also that the CDC is saying when people get sick, if you can, and this isn't always possible, but if you have a separate room where that person can be cared for, away from other people in the home, and even away from pets, that's something that is recommended. I'm getting word that when the feed went out, that folks were unable to hear about social distancing. So I'm going to go back to that, and then we can go back to caregiving and illness. But social distancing is something that's being recommended for those vulnerable populations. So those over 60, immunocompromised, chronic conditions, pregnancy. And it really means laying low, staying at home as much as you can, as much as is feasible, and then also avoiding large groups.
Yeah, that's right. I mean, it's just like what we've been seeing a lot in town, in the county, sort of a lot of large employers having people work from home, some of the schools closing. I expect we're going to see more of that happening.
Right, and here in King County, it's almost that hard not to have to stay away from groups, because groups are being canceled. But for those in other parts of the state, if you're in that vulnerable population, or your client is something that should be practiced as well.
That's right.
So going back to caregiving and illness, I think people will probably wonder, when should I call the doctor? What are the symptoms I experience or my client experiences that might be alarming enough that I shouldn't be taking care of someone at home anymore?
So right now we're really being cautious about folks who have a fever over 100 degrees, folks who are coughing, have a new cough, or have any trouble breathing, like new shortness of breath. So those are kind of our cardinal things. Some of the other viral symptoms include fatigue, muscle aches, just sort of feeling really bad. I mean, those kinds of symptoms are also ones that we're seeing some with the virus as well. I think it's worth mentioning that if you do have those symptoms, it's really worth calling ahead to your doctor's office or to the hospital. Many of the health systems have coronavirus, special phone lines for coronavirus, to sort of assess where you can best be seen or even be tested for the virus. And and to try to avoid sort of people coming into crowded waiting rooms and potentially spreading the virus.
Right. So don't show up before calling, and then somebody with symptoms should be wearing a mask if they have one. And then I know that we will be offering some resources later about how to wear a mask. We'll link out to a video. So it's not just wearing the mask, it's wearing it properly.
And I will say, you know, one of the things we've really come to understand about this virus is it does seem to be respiratory droplets borne and not just like floating in the air necessarily. And so you don't need these like airtight N95 masks and stuff. If you do need to wear a mask, sort of any type of mask covering is appropriate.
Yeah, I think that's a really good point. And while we're still learning a lot about this virus, I think it is important for people to know that we believe it's respiratory droplets. We believe this isn't something you're going to get shopping at Safeway. It's much more likely to be transmitted when somebody is sick and when somebody is coughing. And that's why hand hygiene is so important, because they might cough onto something, which is a great opportunity to discuss proper cough hygiene, if that's a word, where we're coughing into our elbows so we don't get things on our fingers, get things on surfaces, and expose others.
That's right.
Yeah. A lot of people are wondering about a vaccine.
Yeah, and we talked about this a little bit last time, and unfortunately I think we're going to be probably maybe a year away from a real vaccine that's going to work. That's because it takes a long time to develop vaccines and then test them for safety. We are hearing about some research groups that are trying to accelerate that, but I'm afraid that in the near future I don't think we're going to see any kind of vaccine available.
Yeah, that's an interesting thing. So it leaves us to think about what can we do. We can do the prevention piece. And then treatment. My understanding with treatment is that while there are a lot of drugs that are being tested, and we'll know about that well before we would have a vaccine, in the meantime, people who need supportive care can get that care.
Yeah, that's right. I mean, we are taking care of folks with COVID infections in the hospitals, severe cases in the hospital. Some of them need respiratory support. You're right, there is no specific medication that cures COVID at this point, but there's supportive care, and there's other medications, for example, antibiotics for other types of infections that might help people.
Great. People might be feeling really anxious right now. I think this is something that's new. And I just wanted to talk about that, talk about some self-care resources we'll be linking out to our site. We have Tools for Calm, which is our mindfulness program, Ginger, which is our emotional health coaching program. We also have an EAP program. Do you have any other recommendations for people who might be feeling nervous right now?
You know, I would just say it's pretty normal and common right now. I think all of us feel nervous about this because it's a new infection, because we don't know how long it's going to be with us in the community, or we really unfortunately don't even know sort of how bad it's going to be. And so that's all feeds uncertainty and fear and anxiety. So I would say that's a common place for a lot of us to be, and I think talking about it is a good start. You know, sort of and being around sort of other, you know, sort of being able to try to get some information, try to talk to your colleagues about it.
Yeah, I think that's great advice. I'm a parent, and I think a lot of kids are feeling fearful, and I think it's good just to validate that fear and let them know we're going to do everything we can. We're going to practice good hand hygiene. We're going to make sure to stay away from crowds. All those things that we can do, we're going to do. I also think while it's good to be informed, there is a point of being overinformed, and sometimes the headlines can be quite alarming.
That's right, exactly. So we talked earlier about, you know, sometimes it's good to turn off the TV, turn off the news feed, and get away from it for a little bit. I think that's a good idea too.
Great. And then I think people are wondering how to be prepared if social distancing is not just recommended for our most vulnerable, but if that becomes a broader recommendation. I know that there's some great websites out there that can help people get food and medicine and diapers and adult diapers and toiletries, all on board for 2 weeks.
Yeah.
Anything else people should be thinking about?
I would just say, I mean, I also think that that's one of the ways to help deal with anxiety and fear around this, is to just try to
That's a great point.
be ready, be prepared, and not be taken by surprise on it. So if the schools, for instance, should all close and stuff for a period of time, and if it's harder to get to the store and things like that, that's why it might be worth planning ahead. Do I have some milk? Do I have some enough food for at least a few weeks and things like that at home? We don't think that buying water is really important and necessary. We think that the water should be fine and stuff. So, but I think just planning ahead a little bit, sort of what do you think you might need in the house? Medications is a good one too, where you can think about, can I get a couple extra months refills ahead of time right now, so that I don't have to go to the doctor's office, so I don't have to go to the pharmacy to pick those up.
Yeah, and I put some extra things on my list. One was board games, because I can only do so much virtual. The other was coffee, which I haven't seen on a lot of lists, but I think I'd love to have a 2-week supply of.
That's right.
There are a lot of questions from those who are live online, and one of them I've heard you talk about before, and I think would be helpful to clarify. There's a belief that only a certain type of mask will be protective. Can you talk about that?
Yeah, so it's an interesting thing. I mean, in the early days of coronavirus, people were really erring on the side of being extra careful, and so masks like N95 masks, which are really more of an airtight mask, or being recommended. Now, is the CDC, WHO, we really recognize that this is a droplet-borne virus, meaning when people cough or sneeze, those sort of microscopic those small droplets go. So if that's the case, then you don't need full airtight masks, right? And so any kind of mouth covering, basic face masks should work, and that's good in that it doesn't have to be sort of the whole spacesuit kind of thing going on. I think you should be mindful that when your mask, you should probably change the mask if you can every day, if you need to wear it. If it gets wet or damp, you should think about changing it to a dry one.
Great, thank you. I'm sure that's a really helpful clarification. Another question we have, and this one is one I've wondered about, know the answer to because I looked it up, is how long does this virus live on a surface? So if it's on a door handle, how long is it active? And I think that what we're learning about this virus is new, but what we base it on is what we know about other coronaviruses, and that they can live from a few hours to a few days on a surface.
Yeah, and so that's a big range, unfortunately, and so we don't know for sure, sort of with this virus is the case, and so that's why the hand washing recommendation and trying to clean surfaces and things is important, especially after they've been around somebody who's been sick. Right,
the disinfecting of those surfaces. That's a really good one. Another question we have, which I think is going to be a really interesting question, which I don't think we have an answer to, is will the virus go dormant in the summer months? And I think we know from the behavior of many other viruses, including coronaviruses, that this does happen, but it's a new virus.
Yeah, so we don't really know. And that's, I mean, it's possible that'll happen. It's also possible it might be with us for quite a while.
Yeah. And there is a specific question about, could this virus spread in a home environment? And I think, that is probably related to surfaces, the desire to isolate somebody who's sick.
That's right. If somebody is sick at home, I mean, think about it just like sort of how a cold or flu might spread in a household. So if somebody's coughing and sneezing and not covering their cough, touching surfaces, and then you can imagine sort of how within a household infection like this could spread. So same thing goes as if it was for somebody sick with cold or flu at home.
Great, thank you. reviewing all our questions to make sure there are no others. And we know that other questions will appear after the event.
Yeah.
And we can update with answers at that time as well.
Yeah, let me just remind us, I mean, the information is changing every day, if not every few hours, and with this, and so that's why I'm back, and that's why we're happy to keep you up to date, and just know that this is sort of, there's a lot of questions, unfortunately more so than answers in many cases, but I think we're committed to keeping you informed as best we can, keeping you updated as the information changes, and being available for you.
Yeah, there's one new question about, and I think this is probably in one of those gray areas, is it less likely to spread in warmer temperature countries? I don't think we have any evidence, and certainly flu can spread in warm temperatures, and we haven't seen differences with this virus either.
Yeah, so we don't know. I mean, we are starting to see cases in warmer countries as well right now too, so we'll have to wait. It should become apparent sort of with time and stuff, so we'll have to see.
Yeah, learning a lot. So lots of questions about what people should have on hand. I think we talked about that, but I sort of quickly made a list, and I will go through my list more slowly, and maybe you can help with any gaps or anything you want to add. Definitely, I know you talked about medications, and I think that's really important for people to have on hand. 2 weeks supply of food, dog food, diapers, if you're using baby formula, whatever it is that you use on a daily basis that you could run out of, that's really important to have on hand. I think making sure you have cleaning supplies so that if you are in a situation where you yourself or somebody you're caring for is sick, that you can do that disinfecting and cleaning, all the things for hand hygiene. As you said, water, unless you're a regular user of bottled water, wouldn't be something that we would expect we would need. We would expect we would have electricity. It's just a way of keeping people away from people. Yeah,
that's right. And it's it's hard to know for sure, but I mean it's very likely that stores will still be open, right? And I think but if you go to the store, I think you're going to see some social distancing stuff where you're trying to keep, sort of large groups of people away from each other and stuff. But at least so far what we're seeing is, I think the stores will still be open. It's just a matter of trying to minimize your contact if you need to go out.
Yes, I've already noticed that the line at the grocery store, people are spacing themselves a little bit more, which I think is good.
Yeah, that's right.
Yeah. Oh, question about what is the incubation period before symptoms could show up? My sense is it's quite wide. It could be 2 days or 2 weeks.
Yeah, I mean, again, nobody really knows for sure, but it seems like that most of the evidence is, or most of what I've heard for sure, is sort of in the probably 1 to 2 week period is an incubation period. It's hard to know. It's certainly very possible that there's a lot of mild or disease or asymptomatic disease out there that we're not seeing. That would actually be probably a good sign, and if anything, that most infections are mild. So.
Yeah, there's a question on here which I think speaks to a broader question. So it's sort of, I'm in Snohomish County. What's the probability of getting, this virus? I don't think anyone knows for specific geography, but I think even when we look at the countries that have had a high number of cases, it is still a small fraction of the population that is getting sick, and I think that's an important thing to keep in mind.
That's right. A small. That's right. I mean, these high-risk groups that we're talking about, those are the groups that we're really worried about, because we are seeing sort of higher rates of severe illness, severe respiratory illness, or even death in sort of those groups. But it does seem like for a lot of people it'll be fairly mild disease, if any. So we're hopeful about that.
Great. I can see a question being typed, so I wanted to hold on to that. But yeah, I think that's a really good point about benign disease. It's not how we think of an epidemic or a virus, to remember that different people react differently. Your kid can get the flu and be down for a week, and you might have some immunity and just have a few days, or vice versa.
Yep.
Yeah, so there's some questions about disinfectants to use. Clorox and Lysol are mentioned. I have those Clorox wipes at home. Is there anything else we should be using in our homes to keep surfaces clean?
Boy, I'll just admit that I don't know. I think we'd be happy to sort of post any more information we can find about that.
Yeah.
I think from our experience with most coronaviruses or other cold viruses is they're pretty sensitive to anything, any kind of cleaning agents and stuff, and so for surfaces and stuff. So I think I'm hopeful that will be true for COVID too.
Great. So we'll look up, if we find other resources, we'll be sure to link out to that on our site. Can you overuse hand sanitizer? I've had some crackly hands, so that's certainly one risk of overuse. Are there any others?
I don't think there's any medical risks per se. I think the main issue, and we, healthcare workers sort of, you guys face this, which is when you do wash your hands a lot, it's easy for them to get dry and cracked. It can be, the hand sanitizer, because it has alcohol in it, can be uncomfortable, right? And stingy. So that's why I think your point about using moisturizer is a really good one.
Yeah, and then I think your point that soap and water is still the first line of defense and may actually be less drying. And I timed myself when everything was happening about how long I washed my hands, and I was not at the 20-second mark.
20 seconds is a long time when you're washing your hands. That's right. That's right. So, but yeah, that is the recommendation now, and so it's good to do that. I'll get back to just so you know, like in our clinic at Harborview, we're just doing routine sort of cleaning after in our rooms and stuff. So the at least in the hospital healthcare facilities right now, we're not sort of anything. At least in the clinics, we're not doing any particular different cleaning procedures.
That's helpful to know. I think this is a great question that's probably on a lot of people's mind. What do you recommend if you're going to be visiting someone who falls into that vulnerable population? For caregivers, this might be a client, it might be a family member, and are there additional measures? I think the specific concern here is, could I show up and be asymptomatic and spread it?
I guess the answer is like it's possible, but it's possible, I suppose, is what I would say. And I would think that, again, same kind of advice like mentioned earlier. If you are coughing, if you do have symptoms, that'd be a good time to, obviously not go to work and avoid sort of being around people who might be susceptible for sure. Otherwise, I think good hand washing and being mindful about what you're touching and exposing other people, I think that's going to be kind of the rule of the day for a little while for most of us, and especially if you're going to be around people who are at high risk.
Yeah, I think that's a really good point, and I think it's also really important to remember that while there's some evidence that it might be possible to transmit this asymptomatically, the vast majority of transmission happens when somebody is sick.
Yeah,
and
that's right.
Certainly nobody would go to visit somebody who's vulnerable if they had known illness.
That's right.
There was a question that has to do with caring for clients and ability to work, and I just wanted to say that the MRC will be open tomorrow, and they will be fabulous at those type of questions. We're more here to talk about exposures and staying safe, and really the specific piece of caregiving that you're all doing, and doing it in a way that keeps you safe and cares for your client, but that the MRC will be available to answer those questions as well that are more specific. Yes, so there's a caregiver asking about PPE, or personal protective equipment. Is there other protective equipment people should be thinking of having?
So it's actually a really good question, and I think like in our clinic, we're using PPE in patients who are actively coughing, right, and sort of at risk for having viral illness or COVID. So I'll tell you, in our setting, there's masks, and we also are thinking about we use eye covers too, in case you get sneezed on or coughed on, that kind of thing. Gloves and gowns. So that's sort of the full. We're not doing the full space suit or anything like that, but for full exposure for healthcare workers, at least in our at Harborview right now, that's the recommendation for when you're taking care of patients at high risk.
So it sounds like anything that a caregiver can do to create distance between themselves and those droplets is going to be a benefit.
Yeah, that's right. That's right.
That's great. A specific question about pregnancy and contact with COVID-19. Do we know, you had mentioned, we had talked about pregnancy being a vulnerable population, different immunity when people are pregnant.
That's right. Yeah, I mean, I think, and again, the recommendation around pregnancy just came out a couple days ago.
Oh, wow.
And so, but it is recognized that when you're pregnant, your immune system is a little lower than usual. And so I think it's, again, like those other groups of folks we talked about, it's a good time to be really extra careful.
Right, and not exposing yourself to somebody who is ill.
That's right.
Well, thanks again, Dr. Chen, and everyone who joined us to watch live. We know COVID-19 is impacting the lives of many. We want to make sure you're aware of all the resources, and we will be continuously updating our website, myseiubenefits.org. So please visit the website. It will be continuously updated, so the information, as we talked about today, everything is changing on as we learn more. And so as we learn more, we'll make you aware of that by updating our website. You can also find class updates, links to sources that are really credible for helping you stay safe and caregiving, and other information that might be important to you. And your health is important to us, and we're committed to helping you during this time. Thank you so much for joining us, Dr. Chen, and thank you so much for those of you who joined us online.
Thank you.